Now, China has rushed to test an entire city of 9 million within days after a minor coronavirus outbreak, as the WHO warned that letting the pathogen run free to achieve herd immunity was scientifically and ethically problematic. The virus is still spreading rapidly around the world, with well over 37 million infections, and nations that had suppressed their first outbreaks are now struggling with fresh surges, especially in some parts of Europe.
In opposition to economically painful lockdowns and social distancing, there have been proposals in some countries to let the coronavirus circulate in the population to build up herd immunity, where so much of the population has been infected that there are insufficient new victims for the virus to jump to. But the World Health Organization said such plans were unworkable and required mass vaccinations to work.
In most countries, less than 10% of the population have been infected with the COVID-19 virus. Letting the virus circulate unchecked, therefore, means allowing unnecessary infections, suffering, and death.
Meanwhile, China has tested about 3 million residents of Qingdao after a handful of cases were detected on Sunday. Chinese officials intend to test the entire city of around 9.4 million people by Thursday. Hundreds of millions traveled across the country for the Golden Week holiday last week as the country edges back to growth, while rapid tests and swift lockdowns have tamped down secondary waves of the virus. The picture elsewhere in the world, however, is strikingly different as countries battle new waves and alarming spikes.
Around the world, we're now seeing an increase in the number of reported cases of COVID-19, especially in Europe and the Americas. Each of the last 4 days has been the highest number of cases reported so far.
But what we are beginning to see worryingly in places like France, the UK, Ireland and other countries, is hospitalisation rates increasing, ICU occupancy rising, and it's really important that health systems are able to cope with what will be an increasing number of cases in hospital and ICUs over the coming weeks.
Prime Minister Boris Johnson ordered pubs in Liverpool to shut as part of a new strategy to tackle a surge in infections. He said businesses forced to close would get support from the government, but his focus on shutting hospitality venues sparked anger.
We're entering a new and crucial phase in a fight against coronavirus, because the number of cases has gone up 4 times in 4 weeks, and it's once again spreading among the elderly and vulnerable. There are already more COVID patients in UK hospitals today than there were on the 23rd of March when the whole country went into lockdown, and deaths, alas, are also rising once again. These figures are flashing at us like dashboard warnings in a passenger jet, and we must act.
The virus is still spreading rapidly around the world, with over 37 million infections. The pandemic has claimed more than 1 million lives worldwide and sparked efforts to develop vaccines and effective treatments. Some have made it to late-stage clinical testing, but the optimism was dented Monday when Johnson & Johnson announced it had temporarily halted its 60,000 patient trial because of an unexplained illness in one participant.